Today we will talk about NIH SBIR STTR, and this will be like an introductory course, yeah, like in all colleges, yeah, it's a course 101. It's just the basic and the most fundamental information about NIH SBIR STTR. So thank you, Chris. Let's move on.
Okay, great. Well, I'm happy to be presenting today. And as Constantine said, I will go over, first, we're going to start today with sort of the 101 sort of high level look at planning for your project, how to get started, and your specific aims. And then for the 2 sessions that follow this one, we'll go more in depth and in detail about the other elements of the proposal, including the main section, the research strategy, as well as the budget. But today we're going to talk higher level and specific aims. So a quick review from the last session, Dell, provided that high level overview of the rules. So remember, SBIR is for small businesses only. You must be a small business, a for-profit entity to participate, and you have to have fewer than 500 employees to be defined as a small business. It is a 3-phase program with 11 agencies participating. Of course, today we're specifically focused on NIAID and NHLBI and the NIH SBIR program, but there are 10 other agencies that participate as well. Remember that SBIR allows partnerships with research institutions, but STTR requires them. So you can partner with a research institution on an SBIR, but you're limited to only 33% of that total project going out the door to your research partners. But on an STTR, up to 60% can go out the door to research partners. Dell also talked about contracts versus grants. There are contracts and grants, and NIH happens to be an agency that issues both contract and grant solicitations. Again, today we are talking specifically about the grant solicitation from NIH. The contract solicitation comes out once a year in the fall. And NIH issues this omnibus solicitation each year, which is the general call for proposals with topics from 24 institutes and centers, over 200 pages of interest areas from institutes and centers. But NIH also has special solicitations. But we're really talking about the application process related to those omnibus submissions. Now, most of the time, special solicitations very closely follow the general guidelines for the SBIR, but there may be some special requirements, or they may have some additional sections or attachments required. So do pay close attention to the instructions for your specific solicitation. And why these points matter, obviously, we want to ensure quality of your application. And there are lots and lots of rules to know in this program. So we're going to try to arm you with at least enough information to be dangerous. So today we're going to talk about designing your phase 1 project, preparing for that application process. We'll touch a little bit on the importance of storytelling in your application, and then I will go ahead and dive into developing your specific aims document.
Hey, Chris, Pooja has her hand up for a question.
Oh, sure.
Yeah, actually, I'm sorry, I think it might be for Dell, but so when you were, comparing nicely SBIR, STTR, I was just thinking about the budget. I think budget for phase 1 or first year is same, right? Chris or Dell, for first year, SBIR and STTR?
It is, yeah, and we will talk extensively about budget in an upcoming session.
Okay, that's perfect.
Yep.
Thank you.
You're welcome. So if you're new to the program, before you submit, you need to double check your eligibility and make sure that you understand the administrative requirements of the program. At NIH, you really need to have preliminary data to support your approach. Now, the guidelines will say that preliminary data is not required. I can tell you in 25 years, I've never had an application funded that did not have preliminary data and that did not have its approach rooted in peer-reviewed literature. And you need to be really familiar with that published literature, and you sort of demonstrate that through your application. You need to have an understanding of the market and have a basic commercialization strategy in mind. And you'll see all of these things come to life when we talk about the various elements of the application. You need to assemble a highly qualified team that provides expertise in all areas. So for example, I'll give the example when we're talking about team. Identify an opportunity. So are you going to do a special solicitation from an institute or center, or are you going to submit under the omnibus? Verify your registrations are active. Dell touched on registrations a little bit, and the SAM registration is required to be renewed each year. You must have an active SAM in order to successfully submit an application. And it can sometimes take a while for your SAM to be approved or even to be renewed. And then you're going to want to contact your program officer to discuss your idea and get some feedback, if you can, on your approach and plans. So we'll go through all of those again as we work through this session. So let's talk about designing your phase one. So the first thing is that Dell talked about this as a three-phase program: phase one, phase two, phase three. Phase one is focused on feasibility. Phase two is focused on prototyping. And phase three is focused on commercialization. And we know there's a little bit in there in between phase two and phase three called phase 2B, which takes you across that valley of death. Agencies are interested in projects that will span phase one, phase two. So their benchmarks for success are measured at the end of that phase two process. And so they are not interested in funding projects that are done at the end of phase one. So if you only need $300,000 to get you to launch into the market and be off and running to the races, this program might not be for you. The whole reason we do phase one is to get to phase two, because that's where the real money is. So think about mapping out your project across those three phases. What can you hunk off and do in phase one to demonstrate feasibility? What do you need to focus on and fully build out in phase two? And then in the end, what would commercialization look like for you? You really want to focus on your company's core competencies and expertise. So you can look at this a couple of ways. The first is if you are, high-tech experts, you're great at coding and building software. That's great, and you can pursue lots of projects that build software. But if you don't have expertise, for example, in allergy, but you're building a software for use by allergy clinics, you need to bring on those members of your team. So it's okay that you don't have all of that internally, but the focus of your project should highlight one area of your team's core expertise. Think about leveraging existing networks and resources. So are you a member or nearby an incubator or an accelerator? Do you have some really great, solid partners? Are you affiliated with a research institution that could be a partner on the application and strengthen your proposal? Are there particular areas of interest for the institute or center that you're targeting that you have specialized expertise or experience in? And your approaches should be rooted in preliminary data and literature. So for example, if you're proposing animal studies and you're going to use a mouse model, you should be able to cite other studies that are similar that have utilized the mouse model to sort of substantiate why you've chosen that approach to your efforts. And, it is helpful to understand the individual, IC stands for Institute and Centers, to understand the individual institute and centers' desired benchmarks for success. What I've seen happen over the last couple of years is in the omnibus, they used to have these great descriptions of all of their sort of benchmarks and areas of interest. And now they've sort of morphed into posting less information in the omnibus and lots of information on their website. So if you're working on a technology in a particular area, I would start by Googling whatever that area is, NIH SBIR. So if you're doing a medication used by patients with heart failure, I would Google NHLBI SBIR. And then that will take you to NHLBI's areas of interest and their high priority topics specific to SBIR. They each have their own SBIR landing page. You can also talk to program officers to get more information on that, and we'll talk about how to contact the program officer in just a bit. When you're thinking about designing your phase one, you really want to think about these three important questions. The first is, what is your biggest technical challenge that must be overcome in order for you to demonstrate feasibility? What is the one thing that if you cannot do, achieve, demonstrate, complete, then your project is dead in the water. Whatever that one thing is, that's sort of what we want to hone in on for your phase one proposal. So that overall technical challenge, whatever it is, really serves as the basis for your specific aims. So let's say you need to demonstrate the feasibility of a prototype design. That's what you're going to hone in on. You're not going to also develop a user interface and demonstrate the clinical impact of the device. You're really just focused on demonstrating that feasibility of the preliminary design. All the aims should move your technology forward. It's not just research for research's sake here. This is applied research. So I like to think about that as if there's this continuum of commercialization, and just sort of think of like an arrow across the bottom of this screen. In fact, I should probably one day add that to the slide. There's a continuum of commercialization, and at the very start is ideation. And every single thing you do in your SBIR should sort of be moving your technology forward like a little, we used to play the game of life and had those little cars that would move around. You're moving your little car across the continuum of commercialization. So we're not doing anything just to learn more about it. Everything that you're learning needs to be contributing to the development of the technology. So what's your greatest technical challenge? That's our first question. The second thing you need to think about is, how much time do you have? Are you doing a phase one or a phase two? Does the institute or center you're targeting allow 2-year phase ones, or do you have to stick to a 1-year phase one? And then how much money do you have? We know there are budget limitations at NIH, and we'll talk a little bit more about this in the budget section. They're what we call soft limits, so there is a little bit of flexibility. But for example, we know that phase one is focused on feasibility. We know that phase one is typically 1-year project period. And we know that there's about $350,000, maybe $400,000 available for a phase one. Okay, so we know those three things. Those are our limitations. We are not going to propose a 6-site clinical trial measuring the change in outcomes for patients with hepatitis. I mean, that is beyond 12 months. That is beyond $350,000, and that is beyond demonstrating feasibility. So that's what I mean about always sort of align those things together. Think about those three things together. Well, it looks like I covered a lot of this already. So phase one projects run 6 to 12 months. NIAID does allow for 2-year project periods. So you could propose a 2-year project period, and there's often budget limits that are aligned with that. So for example, they'll say you can have a 2-year phase one with a maximum of $300,000 per project year. Now, if you truly have 2 years worth of work that is still within the scope of a phase one demonstrating feasibility, and you are not intentionally stretching that project just so you can get extra money, which reviewers are very keen to spot out, then you could propose a 2-year phase one, no problem. You will have delays in your project. I mean, it's inevitable. So you can work those into your timeline, but you can't necessarily have like a whole quarter of your project period for accommodate delays, just to stretch it out over that 2-year period. So make sure you propose a realistic period for your project. How much money is available? Again, check the opportunity and the guidelines. NHLBI is more sensitive to budgets than NIAID is. And that does vary by institute and center. And when we go through the budget, we'll look at that budget language, which is super tricky. And then you also need to consider the splits for SBIR and STTR. Are you doing an SBIR and you can only send 33% out the door? Or are you doing an STTR and you can offer your research partner a much larger subaward amount to do more work? All right, any questions so far about that?
Chris, you did have a question in the chat around preliminary data. It was asked, can we leverage peer-reviewed data as evidence, or should we generate this data?
Both is fine. Depending on what you're developing, it's really this was always so hard about SBIR, depending on what your technology is and where you are in the development process and what you're proposing for phase one. It depends. It depends on the level of preliminary data that you need to have, but you can certainly leverage existing published data to sort of make your argument and support your case. And we do that a lot when we cover the significance section. You'll see that we do that a lot there. And sometimes that's all we have is, this study showed this study showed this, and we believe that if we kind of combine those things, we're going to show this. So maybe you don't have specific preliminary data on your idea, but you are rooting it again in peer-reviewed published literature that's supporting your approach. So what are the key technical challenges? Oh, I'm sorry, your specific aims. Okay, so aims are limited to 1 page. And I think you should draft these very early because they're really, really important to help us sort of split up the division of work. And so that helps you decide early on, are you going to do an SBIR or an STTR? What are the activities that you need to do in phase one to demonstrate feasibility, and who's responsible for those? Remember, we're basing those specific aims off of this key technical challenge that you must overcome. Now, that technical challenge should have some risk. So this shouldn't be a slam dunk. I just reviewed a proposal that had 3 specific aims that were essentially build, plug, and deploy. It was sort of like all we need to do is build it, and then we're just going to plug it in, and then we can deploy it. Well, there needs to be some sort of risk in there somewhere. There needs to be part of this that is new and innovative and might fail. So if you have something that you're proposing that is simply a plug and chug, that's not appropriate. We got to think a little bit broader about where there might be some risk and what is that hurdle that you have to overcome. Okay, who do you need to recruit to join the team? So think about that early. You need to have the right people in the right seats on the bus. An example I like to give is a client was developing a clinical decision support tool that actually helped with the pre-approval process for oncology treatment. And this team was like whiz bang at tech development. They all came from the IBM Watson program and started this company to use AI and machine learning to improve, the approval rates for pre-approval for oncology treatment. But none of them had any practical application in oncology. And further, none of them actually knew anything about the pre-approval process. So they leveraged their expertise as the tech side of the team. They recruited a research partner who was a clinical oncologist. They recruited 2 payers who came to the table to talk about the pre-approval process. So they built this team that sort of covered all the different angles of the technology. They leveraged part of their core expertise, which was the tech piece, and they served as the lead applicant on the proposal. So just make sure that you sort of cover all of those bases. You also want to get early support and feedback from key opinion leaders and potential strategic partners as you draft these specific aims. Again, right now I'm saying this is really drafty. And what I see a lot from especially faculty is this sort of analysis paralysis. They won't let go of the aims until they're perfect. But it's really important to get ongoing feedback from outside parties and collaborators as you're developing the aims. And from my standpoint, the aims are the first thing that I work through. And it might be, we might spend 3 weeks on the aims, but once you write the aims and once you nail those, everything else can kind of fall into place. Oh, I'm doing a terrible job talking with my slides. But here's more about the team. So think about who's already engaged in the company, and then what kind of roles can people play. So not everybody has to be an employee of the company. Some people do. You have to have team members who are W-2 employees of the company. That's a requirement. But you can also have other personnel at the company who are W-2 employees who maybe you aren't able to name yet, but you'll hire upon award. You can have consultants who have limited engagements with the project. You can have those sub-award sites like a research institution. You can have subcontractors, or you can have fee-for-service providers. Let's say you want to do animal studies and you're gonna contract with a CRO, and they say, okay, we'll do 10 pigs. Each pig is $1,000. That's a fee for service. You can have advisors who provide ongoing advice and input, but they're not necessarily tied to work on a specific aim. So think about who you need to join to recruit your team. A couple of other folks that are key to have on the team. Back, 5-10 years ago, we only thought about bringing these people on in phase 2, and now we need to have them engaged on a limited level in phase 1. The first is somebody with commercialization expertise. So if your team has not commercialized technology, either similar technology or sort of related technology, you need to demonstrate to reviewers that you have access to either consultants, advisors, or service providers who have expertise in the commercialization process. And the next are regulatory and reimbursement consultants. Now, all three of these consultants are probably my favorite use of the TABA funds, which we will talk about when we talk about the budget, the technical and business assistance funds, which allow you to bring in some outside help to address some of those key core business functions. Regulatory and reimbursement, their involvement in phase 1 and commercialization is usually pretty limited. But what has become evident for reviewers and for product developers over the years there are key decisions that you can make early in the development process that can really, really impact your FDA approval pathway. And if you make the wrong decision, you can be making things incredibly difficult for yourself. For example, a client is currently working on a device that interacts, a women's health product that interacts with the cervix. And the question is, do we package the device and recommend a particular suture or a suture kit, or do we package the device with a suture kit? Well, that decision impacts their clinical pathway or their regulatory pathway. And so that's an informed decision that they need to make sort of early on as they're doing some testing and development of the product. So those are the kinds of things that regulatory experts typically weigh in on early on. Is there anything you're doing in the design and development that could impact your future regulatory pathway? Similar for reimbursement consultants. And then leverage your existing network. Find people that you like working with in the past, that you've had success with. These are people that you're going to need to work with during your project period. It's important you kind of like the people you work with. And who's been involved to date that can help continue move things forward. I also recommend sketching the budget early, along with the aims. Now, those two things go in parallel. The aims and the budget are the same story. They're just telling them, one with words, one with numbers. So we do an early sketch of the budget to get an idea of, are you doing an SBIR or an STTR? If you're going to bring on consultants and advisors, how much money can you offer them? If you're doing a STTR or even an SBIR, how much is the budget that you're going to allocate to your research partner? Look at the requirements of the solicitation that you're applying to. Think about the specific aims. The budget, again, needs to align with those aims. It needs to be in reason and align. How much time do you have? Always include, and again, we'll go into depth. I promise we'll talk extensively about the budget. Always include, even in this draft budget that you do, make room for overhead for the company and the fee or profit, which is 7% that the company is allowed to retain from the R&D project. So you always want to make sure you capture both of those things. Well, there we go. Help determine if it's an SBIR, STTR, what percent of the staff can be supported. You need to do that budget early because as I mentioned, you have to have W-2 employees at the company to do the company portion of the work. And how much time can they allocate? How much time is available, or how much money is available in the budget for them to get paid? And consultants, subawards, everybody's going to ask the first question they're going to ask when you ask them to be engaged in your project is how much money is available. So we want to propose that budget or draft that budget that is fair and reasonable for the work proposed. Now remember, the work proposed must be appropriate for the phase that you're applying to. So we need to keep these things aligned. We're not going to submit a 7-site, 2-year clinical trial for a phase 1. We are going to submit a 12-year demonstrate feasibility of one element of the technology around $350,000 for a phase 1. So your specific aims need to align with that requirement. Budget is not a major factor of review. So reviewers do not award points related to the budget. They are asked to consider the budget to see if it's reasonable and appropriate for the work proposed. They are asked to identify overlap or anything that the team may have missed that should be in the budget. But it is not it's not part of the scoring criteria. And most importantly, budget is always negotiated at time of award. So what you're submitting is your ideal budget, but that doesn't necessarily mean that's what NIH will award you. Now, we'll talk about this, the process of determining what your budget is, but I would say NIH negotiates budgets about 25% of the time. 75% of the time, they award budgets as submitted, even if they exceed these caps, these soft caps that you see in the solicitation. So we will talk a lot about that. And different institutes and centers have different policy about budget. So we always propose a budget that is fair and consistent for the work proposed, and then we know that budget will be negotiated at time of award. Your budget's going to include these primary cost categories: direct costs, which can directly be tied to the specific aims. That is the most restrictive type of budget allocation. The second is indirect costs, which are designed to support overall company operations during the project period. And then the fee and profit, which, as I mentioned, is 7%. That is the least restrictive. So we always capture that full 7%. You can use that money for whatever you want. And those things all together represent the total cost. And so when we talk about budget limits in SBIR, we are talking about all-in cost, the total direct, indirect, fee and profit, the total cost. Sometimes at research institutions, they talk about total cost. They mean without overhead, but in SBIR, total cost means with overhead. And I'm sure you have questions about the research institution overhead. Again, we cover all of that in the budget. All right, any questions about those initial thoughts?
Chris, there was a question in the chat, and I took a stab at answering it, but would like to get your opinion as well.
Okay.
Question was asked, do all consultants need to be U.S. citizens? Can advisors be from a German university? And the answer I gave was, it would actually probably depend on what the consultant is doing. If they are materially contributing to the research in some fashion, it would probably fall afoul of the restriction that, all the research needs to be done in the US. But if they were just advising about, non-technical aspects, that might pass muster. What's your take on it?
Yeah, I would say that's a good way to look at it. And I would add a second sort of litmus test is, are they getting paid? Because SBIR money cannot leave the country. And so if they're not getting paid, and they're, as you suggested, Del, just sort of, maybe they're the world's leading expert and you've got them to buy into the project and they're just going to provide some periodic feedback and they're not getting paid, great, they can be involved and you can even include a letter from them. But they could not get paid for their service and be outside of the country.
All right, perfect. And Masha has her hand raised for a question as well.
Sure.
Yes. So I would like to ask a question regarding fee-for-service as compared to subawards. So for our SBIR grant, we are using CROs to perform animal studies, and these cost a significant amount. So we consider it as fee-for-service, but it might be interpreted like subawards, and it's a big difference between. It's like we are purchasing reagents and it's fee for service, so we are not counting them as subawards of 33%. So what would you say about that?
Yeah, so typically a couple of facts that or points that we use to distinguish a subaward from a fee service. The first is subawards have overhead, fee for service don't. So fee for service say, here's the price, and how they got that price and what it's made up of, you know very little. But subawards provide a detailed budget and they include an overhead rate. And the other is the level of contribution to the scientific process. So typically fee for service is you essentially think of it like placing an order. Hey, I know you do this. I need this. Do it for me 10 times and I'll pay you. A research institute or subaward frequently has specialized expertise and they contribute knowledge and input on the project.
Okay. So if we outsource our work to a CRO, that gives us the total cost, and we know what we ask them to do exactly what we want, and they deliver the product. Could this be considered as fee for service?
Yeah, I always consider CROs fee for service.
Very good. Okay, thank you.
And we'll talk about another reason I do that later. It's sort of a sneaky one, but I would always put those as fee for service.
Okay, thank you.
All right, when you're preparing for the process, you know, we ideally want to look at a minimum of 6 to 8 weeks. I mean, ideally, you know, you'd have a good 4 months, 5 months to really sort of do some planning about your specific aims and locate those partners. I mean, it sort of depends on where you are on the project. The project lead needs to plan on at least 50 hours head down writing. And then if you have other team members writing other sections, there'll be additional hours required. Plan on submitting at least 4 days before your deadline. And I say 4 days, not 1, because if you have problems with any of your registrations, you will need that time to sort those problems out prior to the due date. So most things can be taken care of within 4 days. Most of the time, if, for example, you have problems with your grants.gov or your ERA Commons, they will try really, really hard to help you meet that deadline if you had about 4 days. It's almost impossible for them to take care of most of those things same day because they do have a first come, first serve policy. So 4 days gives you a little bit more time to troubleshoot if you have any problems. You also want to allow plenty of time to collect feedback from outside contributors. I think outside contributors are great. I always recommend like your 8th grade niece or nephew who knows nothing about your technology. They should be able to read your proposal, find it interesting, and understand it on some level. But you can also ask key opinion leaders and colleagues. Subaward documents, if you do have a subaward, these can take an extensive amount of time to prepare depending on the institution that you're working with. I would allow a minimum of 3 weeks to get these because these must be routed and approved documents. So the person you're working with at the institution must do all of their work internally, pass it to their Office of Research Administration, who must prepare the documentation, submit it for routing and approval. And check with these partners very early on about what their routing process is. Everybody usually knows how long, you know, the shortest I've ever seen is 5 days. So that's pushing it is 5 days. On the flip side, I do a lot of work in Puerto Rico and the university, most departments at the universities were closed all of July. So anybody trying to submit and prepare a budget with a university in Puerto Rico was out of luck all of July. So make sure you take those things into consideration and check those registrations early. Del, maybe you didn't talk about registrations. Maybe I'm the one that talks about registrations. These are the
didn't cover them, so yeah.
Okay. These are the required registrations if you're applying to NIH. The registrations vary by agency that you're applying to. These are the required ones for NIH. SAM is the big one, and it's the one that takes the most time. It's the one that's hardest to get clear. Once you get SAM, and it's required across all agencies, if you receive a grant from the federal government at all or a contract, you must have an active SAM account for the company. The next is ERA Commons, which many of you are probably familiar with. The company must create a ERA Commons account that is a signing official account, and then you can connect your individual ERA Commons account to the company. Everybody who is key persons on the application, including consultants and advisors, anybody you attach a biosketch for must also have an ERA Commons username. The good news is you can create those for them. And grants.gov and SBIR.gov, those are both automatic same-day registrations. They're very easy. SAM and ERA Commons take time. All right, let's talk about reaching out to the program officer. So this is not required. You do not need to get an invitation or an okay from anybody at NIH to submit your application. In fact, even if you cannot find a topic that matches what you're working on, NIH is interested in seeing your application if it has any implication on public health. So they're willing to take a look at it. Draft a list of questions that you might want to ask the program officer. You are expected to have read the guidelines. So, stay away from things like, how long can I make my specific aims, or what's the due date? Instead, focus on, does your institute and center tend to have specific budget limitations? Do you have any study section recommendations? That's always a good one. Ask them for feedback on benchmarks required. What do they like to see happen in a phase 1? For example, do you need to be in animals in phase 1, or could you put animals off to phase 2? Some agencies, or some institutes and centers require in-human by phase 2 to be competitive. So you want to kind of get an understanding of where you need to be. And then you're going to send them an email and request a brief introductory phone call. I typically tend to recommend including a couple of dates and times that you're available for that call, maybe 4 potential options a couple of weeks out, so they can get that on their calendar. The list of topics and the websites of all of the institutes and centers have SBIR contacts on them. A lot of the bigger centers have gone to this SBIR lead within the center. So, for example, aging has a person that's the person you contact first. I call them a gatekeeper. That's probably a derogatory term, but it's the person you have to talk to before you can talk to anybody else. So if you're doing aging, you're going to reach out to Michael Kearns and you're going to ask for some time with him. You're going to attach your specific aims to that email so they can get a sense of your project. And then the most important thing I'm going to tell you about that call when you have it is your job is to listen more and talk less. So that is really important. And I think that's really hard for people sometimes.
And then
All
Chris,
right.
you have a question.
Yeah, go for it.
Chris, what is the probability that if I resubmit an SBIR grant to NIAID and another grant to NCATS, what is the probability that both grants will be reviewed at the same study section?
Great question. Great question.
Same time.
Yeah. So institutes and centers are organized by disease state and body parts. Review committees are organized by technology platforms. So even if you sent your application to Cancer and NIAID, but it's for for imaging technology. And you're saying we're going to image cancer patients and we're going to image patients with chronic disease. They're both imaging. They're going to go to the imaging review committee, both of them. Now, will they be on the very same study section? It depends on the volume of applications they have. Do they need to create an ad hoc, or can one study section handle all the applications? No idea. That would be a total crapshoot. What are there downsides to the review committee seeing multiple applications from the same company? I wouldn't necessarily say downsides. I'd say it wouldn't be their preference. And so if you can stagger those at all, even by a single deadline, I would recommend it. Unless they are completely different, completely different technologies, or even same technology, but completely different approach, completely different part of maybe what you need to demonstrate feasibility on, where they wouldn't know it was the same company if they didn't look at your name, you know, that's not a bad deal. You can probably do that. But
Yeah.
they are organized different than the institutes and centers.
Okay, thank you.
Yeah. I love to talk about choosing institutes and centers and review committees, and because you can make recommendations or requests for study sections. I love to talk about all of that stuff. I don't think we really touch on that today, but if anybody ever has questions about that, I'm happy to take those offline. So for the process, you know, you're going to create a list of all the required documents. That really helps kind of keep you on target and on task. As we mentioned, you're going to draft those specific aims very early in the process. You're going to shop them with your collaborators. You're going to use it to contact the PO. And there can be changes. There can always be changes to those aims. It should be considered a living document for a fair amount of time. And then the other major element would be that research strategy, which is 6 pages, and then doing the budget. Then you can, once you have those major elements done, then you can focus on all the other little documents, and we will go through every document within the next 3 sessions. And, you know, typically, if you can, use a team to do this, sort of assign things to individual team members that they're better at. This is not uncommon, like on a phase 2 application. Usually the person writing the science is not the same person writing the commercialization plan. So, you know, feel free to assign different tasks to team members. Request support documentation early, like those subaward documents we talked about. And letters of support are really important, and we'll talk about the different kinds of letters of support, but people typically take a long time to get these back to you. They take a long time to get back letters to you that you have drafted for them and provided. They still take a long time to get those signed and returned, so allow time for that. Okay, let's talk a little bit about storytelling. So the importance of storytelling is that it really puts structure around your ideas, and it helps present the content in a logical order. And most importantly, it meets reviewer expectations. And so one of the best ways to improve your grant writing is to serve as a reviewer, because the second you start reading a poorly organized grant, it's hard to concentrate on anything they're saying. Other than be totally annoyed by the use of all caps, or the funky spacing, or, you know, the excessive use of bold, or whatever it might be. So storytelling is really about improving readability and helping the reviewer to comprehend the material that you're presenting. And really, we want to use it to instill confidence in the team and really build some empathy. So the challenge in storytelling with SBIR is, of course, we're talking about this technology that you're going to develop for commercialization in the market. And we know there's a 3-phase program, and what you're working on is in phase 1 is such a tiny little piece of that. So the way that I recommend doing that is always, and you will do this several times throughout the application, always start with the big picture. Here's what it's going to look like in the end. Here's what it'll do. Here's the finished product. And then work your way down to the smaller details. So that's how we sort of frame it for reviewers. We want to give them the vision of the end product first, and we walk them through what it'll look like at the end. And then we sort of get down to the minute detail as we go. This is really important. We need to make no assumptions about what a reviewer knows or understands. I have learned this lesson, continue to learn this lesson in my career so many times. I had a friend that was a county clerk, and she told me once that on days when they had jury trials, if they didn't have any jurors, she would walk through City Hall and randomly select people and deliver them with subpoenas to serve on a jury. And all that makes me think about is, yeah, you say a jury of my peers, but that's not exactly necessarily true. And it's the same with reviewers for NIH. So the program officers, or the scientific review officers, have really good intentions of building these solid review panels. And often they do, but they still have to fill the panel. And at some point, they may pull some folks in who are not necessarily as knowledgeable, but are free on the day of the study section. And so it's our responsibility to make sure that the proposal is understandable by anyone who reads it. Even people who are experts in their specific field and are incredibly worldly and well published might not know everything they need to know about your field to review your application to the extent necessary. So you have a high responsibility to educate and inform the reviewer as they're reading. Now, the trick of this is we also only have 6 pages. So I think that's where the art piece comes in. But we need to make no assumptions. NIH self-reports between 70 and 80% of reviewers are considered new. So we have a whole new sort of generation of reviewers coming in who may have less experience and less knowledge in the field. The review panels in SBIR are, in theory, made up of 25 to 50% commercialization folks and the remainder researchers. Now, a lot of times there's crossover. So there might be a researcher who's also the CEO of a startup. There might be clinicians. There might not be any clinicians. An example I have is this was a proposal to NSF, but I have a client that is developing this really cool technology for nursing mothers, breastfeeding mothers whose children have allergies. And when the mother eats food, that there are allergic elements that are transferred through to the breast milk, and then the baby drinks the breast milk and the baby has an allergic reaction. And my son actually had this disorder. And there's currently no way for a mother to test her breast milk to see if it has any allergens in it. You do the elimination diet, but these kinds of things lurk everywhere in our food. And it was clear to me from some of the comments of reviewers that, and I'm sorry, I'm going to assume men, not women, but mostly men reviewers, didn't quite understand how breast milk works, how women develop breast milk and what might be in the breast milk and how what we eat impacts the breast milk. We failed to fundamentally educate our reviewers about the technology. And it was sort of like a, oh my God moment where it was like, why didn't we do a better job of explaining how this works? We made the assumption they would know. Sorry, that's a long story to get through this. Okay. Formatting can play an important role in good storytelling. We want to remove distractions. See how annoying that is that circle's floating over the word storytelling. So we do that by following the guidelines to a T so that a reviewer sees everything they expect in the order. Reviewers frequently organize score sheets according to the guidelines. So follow those guidelines. Use headers, use the exact same order, number separate sections so they can follow along. Be consistent in your margin size. Use the agency recommended margin size. They do not permit headers and footers. Don't put the title of your proposal in the header or the company name. Just keep it exactly like the guidelines suggest. But you can leverage text to make important points. And the next session, you will see this when I give examples of the significance section, how we leverage text to make really important points. And if you include a picture or a figure, which I really highly suggest that you should, it really does need to tell 1,000 words. So a lot of times I see proposals that have, 50 figures and images, and really we have to pick only the best ones. There's only room for the best ones, or we pick the one that shows the most promising preliminary data. We can't show all of the preliminary data. We have to show the one that has the best view of the preliminary data. Okay, before we jump into specific aims, anything we should cover, Del? Or any other questions?
Nope, there was a question in chat, but I answered it. So
Awesome. Thank you, sir.
no problem.
Okay, this is the formula that I like to use for writing a specific aims page. Now, you'll hear all of us talk about this. There is more than one way to do this. So I do not have any market cornered here. I did not reinvent the wheel. This is just the way that I have written this for 25 years, and it's the way I like to write it, and it does work. Now it's if I had like the template, the key, all of my proposals would get funded. That's not how it works. But I find this order of information to be very helpful, and we'll go through each one in just a second. So I've talked a lot about that specific aims document and how you need to start that first. It's a one-page document, and I consider it the heart of the proposal. That specific aims document is the key document. The research strategy, which is 6 pages, is essentially your your specific aims document on steroids. It's just that document completely blown up. In the other direction, the abstract is just specific aims reduced to 30 lines. And then the narrative, project narrative, which is 2 to 3 sentences, is just the abstract reduced to 2 or 3 lines. So everything stems from that specific aims document. That really is the key document. And once you nail that, everything else should fall into place. Your specific aims, as I just said, is the heart of the proposal. It needs to be consistent with that funding opportunity. So you need to make your specific aims consistent with how much time is available and how much money is available and what phase you're applying to. All of that needs to go together. Your aims should leverage the skills and experience of your team. Now, remember, CROs are great, research partners are great, but even on an STTR, the company has to do 40% of the work. So that can't just be pushing paper. The company can't just be reading reports and communicating with NIH. They have to do some technical effort. So on an SBIR, we know that the company is going to do 66% of the work in-house. On an STTR, the minimum that the company can do is 40%. So you need to make sure those specific aims have room in them for somebody on the company team to do some work. Aims are presented in chronological order, and they start with action words or verbs, and they represent a series of tasks that share the common purpose and lead to the overall goal or outcome of the phase 1. So you have your overall goal of phase 1, you achieve that goal using specific aims. You achieve your specific aims by completing tasks. So we go tasks, specific aim, overall goal. The aims themselves are not tasks. The aims represent the sort of culmination of the tasks. And they have to involve like something technical. So for example, we never have a specific aim being file an IND or a pre-sub to the FDA, because that's not technical in nature. That can be a milestone associated with a specific aim, but that in itself is not a specific aim. And you want to include measurable or quantitative milestones for as many aims as you can. Not always possible, but we need to at least have 1 or 2 aims that have that quantifiable metric. Typically, the last aim does. So specific aims limited to 1 page, presented in chronological order, and start with action words. So this is the formula that I like. The first paragraph, talk about the problem. Why should anybody care? What is this costing in lives, money, time, resources? What is the problem? And, this is why you really need to draft the aims early, because people frequently get the problem wrong. Like they think the problem they're solving is this. And then when I read the project, the specific aims and learn more about the technology, it's like, no, you're really solving this problem. You're not curing the disease. The disease is not the problem. The problem is the current regime of treatments available for the disease. Or, sometimes when we think about cancer, the problem is not, the chemotherapy is ineffective. It's that the chemotherapy causes significant side effects and secondary diseases and illness. That's the problem you're solving. So really think about what is the problem that you're solving. It's not always obvious what you think it might be. Paragraph 2, I think I go, here's an example. Oh, perfect. Okay. So this is an actual example. This is actually from one of the proposals I worked on is on NIH website as a sample proposal. This is from that. So if this looks familiar, that is why. So this is from an actual proposal. This is the first paragraph where he describes the problem is agitation. Paragraph 2, we introduce what's the current state of the art, or what is the current standard of care. So how do people currently deal with this problem? What are they using, and why is it not working? Where is it falling short? What makes you think there's room for innovation here? And I think I have an example of that. Yeah, 2 examples. So this one, there's currently no FDA-approved agents or clinical trials for this disease. So clearly there's a need. And then the second one talks about, there is a current solution, but it's too slow to keep up with the neurosignals. So there's problems involved with it. And there's an unmet market need for a simple and easy to use high-speed TMP imaging system. I changed the technology on all of this stuff. So scientifically, none of it will make sense. And I'm not a scientist, so sometimes it doesn't make sense to me anyway. But the idea is that you can see the structure of the language. Paragraph 3, we introduce your solution. Who are you? What do you do better? What are the benefits? What can you offer? What's it going to be like in the end? Here's an example of that. This is from that same proposal that's on NIA website. They give a very clear statement of what they do and how theirs going to be better. Yeah, this is how I almost always start this section. This paragraph is the company name, their location, and say an Illinois-based small business or an Illinois-based university spin-out or whatever, Illinois-based women-owned business, or just sort of reminding the reviewer that this is a small business proposal. And that's really important because sometimes the reviewers are either serving on multiple panels or you're integrated with other research proposals in the review process. And we need to constantly remind reviewers that this is an SBIR. It is not a research proposal. And then we introduce the project. So what is your overall goal? What do you want to accomplish in phase 1? Who will be involved? If you have a research partner, this is where we mention them. And then we enumerate the specific aims. Now, the whole idea here with this whole section is to get reviewers excited, right? This is like a teaser. We want them to see things that have piqued their curiosity, so they want to read more. Here's an example of that paragraph. We say that they're going to collaborate with their research partners at this university, Dr. Kevin Sharp, and they're going to build off preliminary data. So this is also where we put if you have preliminary data. So we're telling the reviewer right now, we've already got preliminary data. So that's exciting to the reviewer. Then we say what the SBIR will focus on, building the hardware and demonstrating feasibility in a limited study in mice. And then we talk about the team, highly experienced developers and engineers, working closely with consultants and partners at the university and conducting animal studies. And the company has assembled a qualified team of business advisors and regulatory consultants in support of the following specific aims. Then we list the aims. This is another example of what that paragraph might look like. So again, we're going from the overall goal. That's the big picture. And remember that triangle? We're going from the overall goal, what they're building, a SaaS product. But in phase 1, they're going to develop a prototype and test deployment feasibility. That's what they're doing in phase 1. They're not building the whole product in phase 1. That's the overall goal. And here's a look at a specific aim. Starts with an action word, test, the FAME panel, and we tell what the time period is, 12 to 18 months. Now this is still on the specific aims page. So we give the specific aim, and remember this is limited to 1 page. So we give the specific aim, a sentence or 2 about what you will actually do, and then the milestone. Milestones, I never used to put those on specific aims, and then about 5 years ago, I started seeing complaints for reviewers that they didn't know what the milestones were when they read the aims. So now I put milestones on the specific aims page. So that's very abbreviated description of the aims. You will have plenty of room to go into more detail. We are high level here. We are piquing the curiosity of the reviewer, trying to get them interested in the proposal. Another example, again, these are from real proposals. This is a good milestone right here. This is a quantifiable milestone, and it's in aim 3, which is their final aim. And it's sort of at the end in that last aim. And we typically look to have 1 to 3 aims. 1's not enough. 2 seems a little, because we need that third aim is usually like the closer. It's sort of like the wrap-up aim. And in that third aim is where we typically get a thumbs up or thumbs down, a go or no go decision about the technology. And so in this instance, we're saying if they can achieve 95% detection limits of 37 cycles with a sensitivity greater than 95%, they have validated the feasibility of the technology. And in the big picture of things, they've said, okay, that shows this really might work, and there's reason for us to move on to phase 2. So that's the goal of phase 1, is to get to phase 2. Now, sometimes people ask a lot about, in traditional NIH grants like R01s and R21s, reviewers are highly sensitive to interdependent aims. And they are even in SBIR. We will sometimes see that comment. But the disconnect here is that, remember that continuum of product development, of commercialization we talked about, where you're sort of moving your little car along the continuum with every specific aim you have. Everything you do in this project is moving you along that continuum. That's the way product development works. And so in SBIR and STTR, we frequently have interdependent aims because we're developing a product. And so they do build on each other because we're moving along. So depending on how interdependent the aims appear to be, how sensitive it appears reviewers might be to that, sometimes I add in language that specifically says in this paragraph right here, phase 1 aims are as follows. I'll say right here before this, I'll say consistent with standard product development processes, the aims are somewhat interdependent. And then phase 1 aims are as follows. And it's educating the reviewers that unlike the normal research proposal you read here, buddy, these aims are somewhat interdependent because we're developing a product. We're not just collecting data so we can publish a paper. We are creating a product. And the final paragraph is a summary. So this is the last paragraph. It's very short. It's almost always very short. What will you have or know at the end of your phase 1? What do you think you'll do in phase 2? 1 sentence. And what's the commercial market? How big is the opportunity? This is it. Now, nobody's going to come back to you, and if you propose something different in phase 2, nobody cares. But we're painting a picture for reviewers of that continuum of development: phase 1, phase 2, phase 3. This is what we're going to do in phase 1. It'll lead to that phase 2, where we'll do even more. Okay, questions before we talk about, we're good on time, so questions.
Yes, Chris, you had a question from chat. Question came in, are the pay lines for SBIRs typically higher than those for STTRs?
Oh, I love this question because I love talking about pay lines. Okay, so people get obsessed about pay lines. Pay lines are moving targets. I don't care what the program officer tells you, they are moving targets because the agency is always motivated to spend every penny they have. And so there is no way, if their pay line is, the answer is they're different. They're different. Let me just say that. But if there's no way that if their pay line is set at 27 and it's July 3rd and their pay line set at 27 and they have 3 proposals sitting there with scores of 29, do not tell me they're not going to fund those so they can spend down their budget. They absolutely will. So pay lines are always a moving target. They give us a good idea of scores that we need to achieve, but they are not a finite decision about funding. In addition, program officers in SBIR have a little bit more authority to dip down and grab those proposals that are close. So if they typically fund 27, they cannot dip down to 46. but they could dip down to 30 easily, and we use pay lines as information, but not necessarily as a decision as to why we're going to hit a particular institute or center. Now, if all other things were equal and you said to me, well, I could go aging or I could go cancer, everything else is kind of the same. What do you think I should do? I would say go aging all day, because to get funded at cancer, you've got to have very high 20s, like 20, 21. To get funded in aging, you could have like a 32 and get funded. So way more room at aging. But if your technology is focused on cancer and you have tons of solid preliminary data on cancer and your partners are highly engaged in cancer, you probably need to go cancer. So it's something that pay lines are something we consider, but it's certainly not the driving decision maker.
Thank you, Chris. But my question was actually about kind of the chances to get this proposal awarded. If I have the chance to apply either as SBIR or STTR,
that's
which
a good
one is
yeah.
better? Or
That's another good question. And that is also always a moving target because it depends on how many applications they get in. So the pool of money available for STTR is smaller because it's a smaller set aside program. It's the sister program. However, if they have a low number of applications in STTR, then you might have better chances. If that round, and there's no way they can predict what they're going to get in any one round, is SBIR has more money and they have fewer applications there, you may have a better chance at SBIR. So again, we slightly consider those types of things, but what really drives and determines whether you're going to do an SBIR or an STTR is the budget, which is determined by where's the work going to take place, where's most of the work going to take place, and where does the PI need to be. If you're a faculty researcher and you want to serve as PI and you don't want to leave your faculty job, it's sort of a no-brainer to do an STTR.
I see.
Yeah, that's a good question.
Thank you.
Other questions? Della, it looks like you were busy in chat. It says there were 21 questions in chat.
Oh, I didn't even count them, but there were a few. Yeah.
Okay.
But nothing else has come.
Okay. Okay, perfect. Okay, so why is this important? Obviously, we always do this SBIR mapping. How does this tie to your SBIR application? Well, this is the SBIR application, so it's really important to understand the steps required to get started. And I'll hammer again on the importance of starting early on building that specific aims page, to think of that as a living document that you're continuously working on for a couple of weeks as you sort of start to think about the project and talk to potential partners and think about what you might be able to test the feasibility of and focus on for phase one. And then the next section, we'll talk about that full proposal piece, which the specific aims are part of, but we need to do those early. So the next session, we will go over the other key sections, including the research strategy, which is that 6-page main document in the proposal. We will have a budget discussion. And then the third session is on all the ancillary documents that go with that. So your homework is to start thinking about what your team looks like. Where might you have some gaps that you could identify with some expertise that you might be missing? And what are some places you could go to fill those gaps? I think Arsh or maybe Dell or maybe both talked about, the importance of networking. That's a great place to find folks to fill your team in. If you're part of an incubator or an accelerator, use those resources to reach out to some people. And then the other homework would be to start to outline your specific aims, to think about what you might want to focus on in your phase one. That is all the material I have today.
This is Pooja Tiwari.
Yes. Kind of lost you, Pooja.
I think she was on maybe a cell phone and maybe lost service.
Okay. Any other questions, comments, things we need to talk about? Well, it either made total sense or was completely overwhelming and everybody is sort of in shock. I don't know which it is.
So, this happens with me
Chris, can
quite
you
a
hear
lot,
me now?
Chris. And I can tell you this only when people digest everything what we say. So you said everything so clearly that it was fully digested,
Okay, good.
leaving
Good.
no room for honestly speaking, over hundreds of lecture I gave all over the world. Often I feel like I make a glitch or leave something intentionally so a question comes out.
I'll remember that in the future.
Yeah, please. But if you are 100% clear in making your point, audience do get like totally stuned and they have nothing else to ask. So I guess that's what you did today.
Okay, I hope so.
I have to remind this to myself all the time. So I'm telling you from my experience. No question doesn't mean that there was job not well done. It means job was superly done. That's
Okay, all right, I'll take that.
And even I'm like a question. I generally can never have not a question, but like today everything was so crystal clear.
Okay, good.
Yeah.
Okay.
And one thing about the budget that I have in the beginning, you even touched upon that very clearly, and the pay lines and everything. So I guess there is literally nothing even for first timer to go and apply for these grants.
Okay.
That's not there. So thank you so much.
You're welcome. Okay, well, Del, if there's nothing else in chat and nobody else has any questions, I'll give you back 14 minutes of your day.
Yep, sounds good to me.
Okay. We'll see you next week.
All right. Bye, folks.
Bye, everybody.